Australians are practical people. We like things that work, that do something. So what about a useful, everyday diary for women, full of essential health information that saves lives? Now that's something. The Australian Women's Health Diary funds breast cancer trials. Every dollar goes to trials research that saves and improves the lives of people with breast cancer. The Australian Women's Health Diary, the diary that saves lives.
G'day everybody, good evening. My name's Annabelle Crabb and I'm absolutely delighted that so many of you could join us tonight for the latest breast cancer trials Q&A. Breast cancer trials is the largest independent oncology research group in Australia and New Zealand. They've been conducting clinical trials, research into the treatment and prevention of breast cancer since 1978. And tonight, I'm very happy to say, because this question comes up in a lot of our sessions around breast cancer treatment, that we are going to be looking at the topic of the role and impact of diet and exercise in breast cancer. Not only is it a subject of interest because it's something that people can control in their everyday lives, but it's also a subject of interest because it's a topic on which you're most likely to get the least helpful advice from your friends and family. Let's face it. So lots and lots of questions and lots of attendees at this session tonight. We've got, as we go to air, we've got about 3,170 of you online, keen for information from our panel of experts that we have lined up, and we're going to be answering as many of your questions as possible on this topic and provide an update on the latest in research. Now, before we get underway with all of these questions, and we have many, I do have a little bit of housekeeping, and the first is to acknowledge that we are beaming into this session from all parts of Australia and New Zealand, from the lands across those two great countries. And I'm coming to you from Gadigal land this evening, and I expressly would like to acknowledge the traditional custodians of this particular patch of the continent, but also I'd like to acknowledge the centuries and millennia of custodianship of wherever it is that you're joining us from this evening. Now, you'll be relieved to hear that I am not in charge of the technological running of this session. We have much better placed people than I am to do that, but I will tell you how this Zoom works in practice. If you move your mouse over this, no, your mouse, not your mouth, don't do it with your mouth, that'll be crazy. In the bottom right-hand corner of the screen, you'll see three little dots. And if you hover your mouse, I keep saying it, don't I? If you hover your mouse over the three little dots, you'll see some options that you can make a comment or you can send a question. If you click on ask a question, we've got a bunch of pre-submitted questions, but if you send one through, that will be read and monitored and you'll get some answers. So the other exciting thing that we're going to do this evening is we're going to be asking you some questions in the form of some polls. We've got a couple of them to check out what's going on among all of the thousands of you that are tuning in, and you'll be able to access that through those same three dots if you just click polls. I'll let you know when we're asking the questions, don't worry. So I think we're just about good to go, and it's time to introduce the panel. As ever, we have a what I call an OP, ordinary person member of the public, who is here to talk about her own journey with breast cancer. I'm very, very pleased to have Melissa Bell joining us. She's zooming in from New Zealand, and Melissa was diagnosed with breast cancer in 2013, so just over a decade ago, and she is also a member of the Breast Cancer Trials Consumer Advisory Panel, and we'll be chatting to her in one hot minute. We also have Dr. Di Adams, who's a senior staff specialist in medical oncology at the MacArthur Cancer Therapy Centre. She's the leading medical oncologist on the Clinical Oncology Society of Australia Exercise Committee. Right. We also have Professor Marina Reeves, who's a professor in the School of Public Health and Deputy Associate Dean of Research in the Faculty of Medicine at the University of Queensland. She's also an advanced accredited practicing dietitian. And we have, lastly but not leastly, Dr. Eva Zopf, and she's from the Australian Catholic University, and she's an exercise physiologist, and she has a PhD in exercise oncology. I think, Eva, you are our first exercise physiologist to join one of these sessions, welcome. We always like having a neophyte expert on the panel. Thanks to all of you, and thanks to everybody who sent in questions. As I said, we've got more than 3,100 people who have registered for this Q&A topic, which I think reflects the degree of interest in this area, whether it's related to whatever kind of breast cancer. These questions come up all the time. I'm aware too that as well as people who are on their own breast cancer journey, we have a lot of people online tonight who are friends and family and who want to support their loved one in the best possible way during what can be a very scary and overwhelming time. The point of these panels is to put you in direct contact with people who really know the answers to your 3 a.m. questions, and we have them all together so they can bounce off each other, which is super useful, particularly if you're at the beginning of the journey and you just feel nothing but just overwhelm and terror. Okay, so thank you, everybody. We're going to start by having a little look at the range of questions that you sent in to our panel. Okay, so I think you're getting an idea of just the breadth of the range of questions we've had on this subject. And look, I'm going to start with Melissa because I think it's good to start at the beginning with the story of what happens when you're diagnosed with breast cancer. I know that there's people on this call who know that experience all too well. Melissa, welcome, and thank you for joining us. Melissa Bell, I'm going to ask you just to start by telling us how you first came to be diagnosed with breast cancer.
Sure, thanks, Annabelle. I was diagnosed in 2013 with stage 3C breast cancer. I didn't present with a lump, so I had a small indentation in my chest, and I was actually at my GP heading overseas and just got them to randomly check this and was a bit blindsided by the diagnosis. So at the time, I was multifocal, so I had multiple tumours. I had extensive lymph node involvement, and I was triple positive, so HER2 positive plus positive for estrogen and progesterone. So yeah, that was my diagnosis, which I was only 40 years old, so too young to receive mammograms in New Zealand, so very unexpected.
Okay, that's I mean, it's never not a shock, but that is a real 0 to 60 moment for you, because you're finding out something detailed, multi-layered, and something that's come as a bolt from the blue. And I think you were about to go on a work trip at the time, weren't you? Which all had to be re-engineered.
Yes. Yep. I was bags all packed to go off to Japan and Korea for work, and it's a real, I had a young family. It was very much a spanner in the works, which it is for a lot of us when we are diagnosed.
Right. Okay. So this format allows me to ask very rude and probing questions. So I don't have any problem at all, Melissa, in asking you, give us a snapshot of what your diet and exercise profile was at the time of this really surprising diagnosis.
Yeah, look, I think when I look back at it, I was probably in the best shape of my life. So I was eating well. We're a family, we enjoy good food, but we Yeah, I was eating well. I was training for a half marathon. So I was pretty fit. I was running most mornings or going to the gym. So when you get diagnosed, sometimes we look back and we look at our lifestyle and think, well, are there things there that perhaps should have been signs, and there really weren't for me. So it was very much an experience of shock.
Okay, so I'm going to guess that given your triple positive status, you would have had every single thing by the kitchen sink treatment-wise. Do you want to just run us through what treatment regime you were going through before I even think to put exercise on top of that?
Sure. So I started with a mastectomy and axillary clearance. So I had my lymph nodes removed. I had 12 weeks, 12 rounds of chemotherapy on paclitaxel and FEC. I had 6 weeks of radiation treatment, and then a year of Herceptin transfusions, and then 10 years of endocrine therapy. And in addition, after my chemo, I had a mammogram on the remaining breast, which showed DCIS. So I then chose to have a prophylactic mastectomy, so bilateral mastectomy. So yeah, I had the whole range of treatment, and it was, for some time. So I've only just concluded my treatment, really.
Wow. Okay. So I don't know what the medical term for that is, but the human journo term is hectic. That sounds very hectic.
It's a polite term.
So what sort of, that's a lot of information, that's a lot of treatment, that's a lot of detail. Was there any room for discussions about diet and exercise in amongst all of that?
Yeah, I was really lucky that both of my breast surgeon and my oncologist were very passionate about the benefits of exercise. So we did talk about that quite openly, and I was really fortunate to be in Dunedin, where Otago University ran an ex-PINCT exercise program specifically for women with breast cancer. So that was just quite profound in terms of the impact on my mental health as well as my physical health, and just in terms of establishing connections with other people who have been through treatment and were going through treatment. So we did talk. I found the diet side harder. I did ask to meet with the hospital dietitian, but I just got such generic information. I got, I think, a copy of the food pyramid and got told to take it away and read that. And I had all the big burning questions like, well, what about fasting? And what about, everyone's talking about soy and everyone's talking about sugar. And, I think I was hungry for information, because when you're diagnosed, your diet and exercise are two things you can control in a world where a lot of control's been taken away from you.
Yeah, that's such a good point. And I'm keen to hear a little bit more about the ex-PINCT program. I'm just going to translate from Melissa's Kiwi there. It's ex-PINCT, which is capital E-X, capital P-I-N-K-T. Now, that's a specific program designed to help people cope with breast cancer, treatment, everything. What sort of stuff were you doing at different stages of your treatment?
Yeah, it was great. So after my surgery, it was very much focused on mobility around my chest and my arms, and ensuring I was doing my physio exercises, which some of us aren't good at doing when we're left to our own devices. And then it had a focus on strength training. So we were lifting weights, and it was great for me because people like to wrap you in cotton wool when you're diagnosed. And it was great to feel strong and powerful. It was great for bone density during treatment. So we were set up with the personal trainer who developed a program. And then after a certain number of sessions, we could come in and work in a circuit with other women and men going through treatment. So it was originally just for breast cancer, and then it opened up to prostate cancer as well. So it was a great community.
That is amazing to hear about. I will be testing you later on the food pyramid just to make sure that you absorbed all relevant detail from that. I'm going to just go to you now, Dr. Di Adams, who's the Senior Staff Specialist in Medical Oncology at the MacArthur Cancer Therapy Centre, just to remind you. Di, just quickly, how does that system sound to you, the ex-PINCT one? are there enough patients getting that kind of joined up information about diet and exercise?
We would like more, Annabelle. So the answer is always we would like more. So there are options. The problem is for Medicare funding for exercise for our patients. That is a particularly difficult area for our patients. If we could prescribe on a script pad exercise and actually get it funded for our patients better, I think everything that Melissa has encompassed in terms of what she did to help herself, the empowerment, the cardiovascular, the strength-based, the shoulder movements, everything, and then just the feeling of actually taking control again is so important. It's such an important transference that an exercise physiologist or a physiotherapy person can actually give our patients. So we give our patients a list of things we want to do to them that generally carry some consequences that might actually make them feel less well in the short term and hopefully not the longer term. And exercise and diet can reverse that. And we worry about the accelerated aging that all our treatments can actually give. So you had a brilliant interview with Bogda last series. So that was on heart health. We know that if you exercise, that actually can maintain your cardiovascular capacity. And so therefore your exercise training was extinct, said with a New Zealand accent, is excellent, because any worries about that loss of cardiovascular capacity is being negated, or is being protected by exercise. So Annabelle, the hardest part is actually saying, how do we fund it easily and actually creating good pathways? We're very lucky where I work that we've got a brilliant exercise physiologist, and her name is Hope, which is just the best name for an exercise physiologist. But not all centres have the ability to tap into someone easily. And the difficult part is that not every state or territory government has an in-house exercise centre to help our patients.
It's interesting because, and I'll be coming back to Melissa on how her way of exercising has changed over the last decade. But it's interesting to think that even someone like Melissa, who's in really good shape, she had to change the way she exercises. She had to relearn how to exercise. So it wasn't even just a question of a fit person just doing what they were doing, right? There's actual information and knowledge involved in teaching this stuff, and we'll be talking about that over the rest of the session. But Di, I wanted to know from you just what are the most common concerns you hear from patients around this topic?
So I think the first is it safe for me to exercise? When should I commence? And where do I go? And how can I afford it? And so that's probably some of the hardest questions that we face. So I think the ability to actually access someone who can see our patients quickly and actually give them the safe information of a structured exercise program, which is it's personalized. And I think that's probably the most important thing, is it's the worry that you might be somehow undoing something that the surgery, you've been told by your surgeon to do a certain amount, and at what stage can you safely progress onwards. So I think having someone who's actually trained in cancer rehabilitation, so there are certain accredited exercise physiologists through ESSA, so Eva would be a key example of one, and so therefore, and the Physiotherapy Association as well. So obviously trying to not just go from, the clinic to suddenly a gym. You need to go and see someone to make sure it's safe, the exercises that we would recommend, and that it's graded and it's graduated upwards and it's personalized to help our patients.
The pernicious thing about it is, of course, that just because there isn't a satisfactory communication or network of information within your formalized care system doesn't mean that information isn't more broadly available. What people do when they feel like they don't know is that they turn to Dr. Google, right? Or they listen to people around them or friends or other people who have had breast cancer. And how difficult is that? I mean, how much do you run up against that, Di, in your line of work in terms of myths about diet and exercise?
So in general, we try to avoid Google where possible, but where possible, we try and direct them towards trusted websites like the Breast Cancer Trials Group and also the BCNA. We are very fortunate to have McGrath nurses that support our patients, and generally they can actually recommend trusted resources. So where possible, we try and give them, evidence-based guidelines and safe places to be steered to, rather than trying to find their own way.
And isn't this sort of public information that you get on websites or Dr. Google or somebody who says that as long as you drink, 28 liquefied kiwi fruit a day, you'll be absolutely fine? Or is that more influential on people than the family and friends? I know someone who did this network, or is it a bit of a hot mess?
Look, I think everybody's trying to help people. When you're first diagnosed, everybody is trying to help. So they don't realize perhaps they're recommending something that perhaps may not be something that actually genuinely is endorsed by, dietitians. And so everybody's in their own way. They're trying to help their friends, but where possible, steer clear of things that are not endorsed by people like Marina and Eva, and people who actually have established guidelines. So,
okay, great. Well, that's a terrific start. I'm going to go now to Professor Marina Reeves, who I'll remind you is from the School of Public Health, and she's a Deputy Associate Dean of Research in the Faculty of Medicine at the University of Queensland, also an advanced accredited practicing dietitian. This is the thing about you, all you experts. You've got lists of qualifications that are much longer than mine. I'm just a journalist, but thank you for joining us tonight, Marina. And I'm going to start by asking you about the evidence and research behind the impact of diet and exercise with early stage breast cancer. I think you're on mute, Marina. God, I love it.
Off to a great start.
Normally it's me, so I'm just relieved when it's somebody else.
So a lot of the research we have on diet and exercise really started from research around cancer risk. So a lot of the research has come from what do we know are the risk factors associated with developing cancer and a whole range of different cancers. And over the last few years, we've had more and more research looking at people who've had a breast cancer diagnosis and then looking at what are the factors that are associated with their disease progression, the survival risk of recurrence. And so we're now starting to get more and more evidence around what can we be recommending to women based on this evidence. And that evidence, though, is still observational evidence. So it's not necessarily causation. It doesn't tell us exactly what an individual person should be doing, but it's the evidence that we go to for the best guidance of kind of where to start. And important, the other thing really to remember is most women who are diagnosed with breast cancer will survive their breast cancer. The majority of women are going to survive. Most women, though, and men, go on and will end up developing other chronic diseases like cardiovascular disease. And that tends to be the biggest complication that people have later in life. And so the evidence that we do have around what we know for breast cancer prognosis is also the same evidence and recommendations that we'd give for overall health and well-being. So I think it's important when we're talking about this to know what we're recommending around improving breast cancer outcomes is still really the same recommendations we'd give people for their overall health and well-being. So we know that people who are more physically active tend to have better health outcomes. So lower risk of recurrence in those who are more physically active. We also know, though, women who increase their physical activity then are better at managing some of their side effects from their treatments and have lower fatigue, better quality of life. And I'm sure Eva's going to talk a bit more about that when she shares some of her work. So we know physical activity is likely to be beneficial, not just in terms of reducing risk of recurrence, but overall quality of life as well. When we think about diet isn't a single behavior and is much harder to measure and study. And so there's a whole heap of complexity that comes with that. What we do know from this research that World Cancer Research Fund summarised is that dietary fibre, so people who have a higher intake of dietary fibre have better health outcomes. We also know that people who follow healthy dietary patterns, which is very generic because every study measures a healthy dietary pattern a different way, those people who have healthy dietary patterns tend to have better health outcomes as well. And so that's typically things like higher intake of vegetables, green leafy vegetables, cruciferous vegetables, coloured vegetables, fruit, whole grains, legumes, nuts and seeds, and low in foods like processed foods, added sugar, sugar-sweetened beverages, and red and processed meats. So they're the typical dietary patterns that we know are associated with better health outcomes.
Okay, so sorry.
Oh, no, you go.
I was going to say, I know that, I hear everything that you're saying about how this meshes into other patterns and how this is not really just information about breast cancer patients. But is there any is there any point of the cycle at which diet and exercise, or any particular kind of breast cancer, where diet and exercise becomes more sharply relevant? Like, so metastatic breast cancer, for instance.
So I think it's relevant for all, because as Melissa's alluded to and Di's talked about, there's a whole heap of misinformation that people get. Metastatic breast cancer, I would say, is probably a group that's even greater impacted by that, but all people diagnosed with breast cancer, I think, would benefit from some evidence-based guidance and advice around diet and exercise. Metastatic breast cancer is a really interesting group, because where I've talked about all of this evidence that we do know, people with metastatic breast cancer have typically been excluded from all of those trials. So we have very little evidence on what we should be recommending for those people.
Why is that?
Because they've typically been thought of, they're too hard, there's no point in studying them, they're too different, so we just exclude them, and we're only going to focus on the people who we know are being treated with curative intent. So this has been historically long time, they were excluded. And also, because we didn't have any evidence, what should we be recommending in terms of physical activity? What should we be recommending around anything when we don't know what the prognosis and long-term outcomes for this group is? But we now know that these people tend to be living a lot longer, but they're living a lot longer still with significant morbidity because of the side effects from the treatments. And still those treatments and that disease progression, Di talked about the accelerated aging that we get with treatment. People with metastatic breast cancer don't stop treatment. And so they continually are going through line after line after line of treatment. And all of those treatments are having a continual impact on their body and particularly their muscle mass. And so that's where we're particularly interested in the role that diet and exercise can have for that group of women in terms of maintaining their muscle mass. When we've spoken to women with metastatic breast cancer, they said to us the thing that's most important for them is maintaining their physical function. They want to be able to keep doing what they're doing for as long as they possibly can do, and that is really crucial for their quality of life. And we know the main thing for maintaining their physical function is maintaining that muscle mass. And so we can do that best through diet and exercise.
Yeah, I guess it's a huge blanket to be throwing over a field of people, isn't it? Just people who have some sort of interaction with breast cancer, because they have completely different sources of anxiety and priorities, right? Like, I mean, whether it's feeling unwell, feeling lethargic, feeling sort of confused and despairing, worrying about weight loss, worrying about weight gain, like there's a whole kind of spectrum of concerns. Where do you start to get proper information and support around diet and exercise?
I think, Di talked about this a little bit before. So, the biggest source of where people go to is either Google or Facebook groups, which Melissa talked about as well. But we know that they can be really good for support. So those Facebook groups can be really good for giving that peer support. But they can, or Google, or well-meaning family and friends, actually be a source of misinformation. And so for us, it's around how do we make sure, direct people to those best sources of information. So we've worked closely with Breast Cancer Network Australia to make sure that the information that they have stays up to date and relevant and evidence-based. And so directing people to those sources, Cancer Council websites, for making sure that they've got the best information. Now, that's just information. Information alone, though, isn't enough, and we know that it's not enough.
Okay, so I guess your advice to people is to try and stay focused, not get distracted by advice that might well be irrelevant at best and damaging at worst. So is the best approach to make sure that you run past all your plans, through your entire clinical team?
I think ideally you want to be talking to your oncologist or your clinical team around, if you've got questions, if there are things that you're wanting to try or do, you should be running that past your team, not because they, ideally won't be telling you not to, but it's really important for them to understand in case there are interactions with the treatments that you're having. So really important that they understand what you're doing, and then using within your hospital or clinic seeing where you can get access to additional support. So is there a physiotherapist or an exercise physiologist that you can be seeing? Can you get access to the dietitian? Some hospitals are really lucky in terms of they have additional support that you can go to for information. But I think if you're getting blocks or you've been given information that you're not sure of, trying to find the best avenue of who you can speak to help you for navigating that. And it may be the breast care nurse, or it may be someone else within your healthcare team who can help direct you.
Great. Okay. Well, thank you, Marina. I'm going to switch up the mode and ask some questions of our audience now. It is time for us to head to our first poll. We've got a couple of questions for you for our first poll questions. If you look at the bottom of your screen, you'll see those 3 dots, and one of those has our polls. Our first question is about diet and whether diet had an impact on your breast cancer experience and quality of life during treatment. So get stuck into that, and we'll come back in a few minutes to let you know the results of that poll. In the meantime, I will be asking our first question ever to a qualified PhD in exercise oncology, Dr. Eva Zopf from the Australian Catholic University. Welcome. Great to have you on board. I wonder if you could start by telling us a bit about your own research, and in particular, one of the most beautifully named studies I've come across in this field, the preferable effect study.
Yeah, thank you for having me. So my research focuses on how exercise can help in the management of cancer. So that might be in how it can help prevent or counteract some of the side effects, and how overall it can improve, overall health and well-being. And we just heard from Marina that there's has been a lot of research into sort of the early stage breast cancer. And with a preferable effect study, it was a large international study that was funded by the European Union and HMRC, and we actually aimed to included over 350 people diagnosed with metastatic breast cancer, because we really wanted to see how exercise can support these patients who, as Marina said, they receive ongoing treatment, they often have a higher symptom burden, and whether we can support these patients as well. So what we did in this trial is we compared a group of individuals who took part in a 9-month supervised exercise program, where they had 2 supervised exercise sessions per week, compared to a group that just received general exercise advice in a physical activity tracker. And then we had regular assessments where we looked at how they improved in their physical performance, but also in their quality of life, their side effects, and so forth. And we actually saw, and the intervention, I should say, was a combination of aerobic training, so cycling on a bicycle, resistance training, so lifting weights, and also some balance training as well. And what we saw is that we not just had significant improvements in quality of life and physical fitness, but we actually also saw that, the patients in the intervention group had less pain and less breathlessness than patients in the control group, which are 2 really common side effects or symptoms that these patients are experiencing. And in addition to that, and that was one of our primary outcomes, they also had less fatigue, so that, tiredness that many individuals experience during their cancer treatment. So that was really nice to see that we can really support these patients or these individuals with advanced disease as well.
Eva, I mean, it's such an ironic thing, isn't it, that, that these side effects that you describe and symptoms that are so common, breathlessness, pain, and fatigue, that can be eased, as you've established, through exercise, are also the things that make you stop feeling like doing exercise. So how do you break through that barrier with patients when they're just feeling like they're on the mat from all of this clinical intervention?
And it's such an important question, because we actually know that pain and fatigue are one of the most common barriers. So it was really nice to show that exercise can be effective or help improve these symptoms, and it'll hopefully help educate, not just patients, but also or individuals diagnosed with breast cancer, but also clinicians and other people in the community. It can be so challenging to motivate yourself when you're feeling unwell. And I think it's important to just keep in mind that some exercise is always better than none. and that there'll be days where you can do more and there'll be days where you can do less, and that's completely okay. So in general, what can help is to exercise during a time of the day when you feel most energized, so less fatigued, or in general when your side effects affect you least. And sometimes it helps just, having a diary and checking, when are your symptoms worst, and tracking that, and then finding a time that works best for you. And then, there's small tips and tricks, sometimes just getting your family member or a friend involved to exercise with you, to build up a routine can be really helpful. That it just really feels odd if you don't go for your walk in the morning. So those are, small sort of tips of how to integrate. Also just exercise into your daily life, parking further away from your home, taking the stairs. It's simple things that, even if you can't hit the gym on a day, you can do to improve your or increase your activity levels.
We know that a lot of women at the stage of life when they're encountering breast cancer are also managing a bunch of other stuff in their lives, right? Like kids, relatives, work. They feel like I've got a lot of balls in the air. Is there a perception sometimes that they only have a limited amount of energy to expend, and rather than expend it on their own well-being by exercising, they'll use that energy to look after the kids, or is there a misconception that energy is a sort of finite resource, that you get a certain amount of it every day and you can blow it on this or that, but you can't do it all and exercise as well?
Well, absolutely. I think it is really tricky because particularly if you think of those women or men diagnosed with advanced cancer, the fatigue can be really debilitating. And then, picking and choosing what you spend your energy on can be really hard. And so there, it also helps not just to have your diary, but also then to say, okay, on Monday you might do your shopping, and then on Tuesday you can do a bit of activity. So you can break that up. Or, there's so many, family or friends that want to help with something, and that can be something, that can be really helpful. So can you do the shopping for me, that I can actually go for a walk and spend my energy on something, that will help myself. So it's tricky. It's definitely challenging. But what we do experience is that these patients, or these individuals, should really, their fatigue improves if they're active. And it sounds so counterintuitive to, go to the gym or go for a walk if you feel really fatigued. But we get a message from women, after coming to our exercise sessions, just saying, I felt so fatigued and I'm so glad I came because I feel so much better now. So trying to, get into that habit can then help to, break through that cycle and just feel more energized to get on with other activities in life. And that's also social activities that, a lot of individuals feel like they're missing out on or don't have the energy for.
Okay, so Eva, are the findings of your study relevant equally to people at every stage of breast cancer, age and type?
Yeah, so absolutely. We actually had, prior to the study, we had quite a lot of evidence in individuals with early stage breast cancer. So probably the most evidence in the exercise space has come from people who are diagnosed with early stage breast cancer. And we have strong evidence that exercise can help improve fatigue. Also in those individuals, it can improve quality of life, improve physical fitness, overall mental well-being, so anxiety and depressive symptoms. There's more and more evidence emerging on other side effects of treatment, such as bone health, sleep, cognitive function. I could probably go on and on. So absolutely, we have very convincing evidence for the earlier stages, and we're trying to build on that with looking at these studies in those with more advanced disease as well.
Great. Thanks so much, Eva. I'm going to ping back to Melissa now, because as someone with a really good lived experience of this exact situation, having all of these treatments thrown at her, you obviously pre-diagnosis had a pretty good track record of being into exercise and not having so much of a difficulty motivating yourself, did your appetite for exercise change over the course of that series of treatments?
I think I was still really committed to exercise, but I think, and I guess, I was thinking as I heard the panelists speak about the fact that at the time I was diagnosed, my friend group were into exercise. So it was a big part of my life and part of my social life. We would walk and talk, and and it is a bigger challenge, I think, if you weren't invested in exercise as part of your personal habits beforehand. But for me, I think, I stopped running. I don't think I've run since actually I was diagnosed. And I was more drawn.
Tell us why you stopped running.
I think, do you know what? I think for me, running, I don't know if I ever loved running. And it was something that for me it was pressured, and it was quite stressful. And I was always looking at improving my time. And I think I sought something different from exercise, which was a sense of peace and calm. So it became very much about mental health as much as it did about physical health. So I became a walker. So I walk, and I walk to this day, go on long morning walks. I still did a lot of gym work. But for me, I spend a lot of my time exercising on my own now, but that's for my mental health, and it's my space and my time. So it definitely changed for me, but it was important through treatment and after treatment.
It's so interesting. And was being kind of in the outdoors and being part of nature and having a bit of a sense of yourself in the place of the broader world a part of that as much as the physical exercise?
Yeah, look, I was the cliche that I think, the day after I was diagnosed, I literally pulled over in the car to smell the roses, and so I think, I admired every sunrise and sunset. And I think for me, when I was diagnosed, you realized what matters in your life are the little things that happen on a daily basis, not the big things that you think are defining. So for me, I was really drawn to nature, and I walked outdoors a lot, Dunedin people around Ross Creek or at the beach. And then the walks weren't long enough, so I started tramping. And that's my absolute happy place now, is, down beside a river with a pack on my back is where I've found a sense of peace and of strength. So for me, that's been really, really important.
That's really interesting to hear, Melissa, because I think often we think of ourselves as either exercise people or not exercise people, but the truth is you can evolve during this process, and certainly feeling more connected to the world around you is kind of a difficult to quantify, but really important part of maintaining that mental health as well. I'm just going to break to give you the results of that first poll that you were all so good at finding and voting on. Okay, so in response to the first poll question, 66%, thank you for making yourself into 2/3 of the audience, thank you, said yes, they did change or modify their diet after they were diagnosed with breast cancer. And 63% of people said yes, their diet changed and improved their quality of life during and after breast cancer treatment. So that's a pretty significant majority. Going to go back to you now, Di, and start in on the many and varied questions that have been sent in by our viewing audience this afternoon. Peter has asked if she can reverse the osteopenia through diet and exercise. And would you please, just for my benefit, tell me what osteopenia actually is?
Okay, so osteopenia, if you wonder why sort of suddenly a medical oncologist is starting talking about bone health, is because a lot of the drugs that we actually give can actually affect bone health. So routinely in a breast cancer clinic, quite often we are talking to our patients about their bone density. So it's a reference to what our bones used to be when we were 20. Okay, so when we were 20, we had certain scores, and quite often if you look at a scoring system, the score was 0 or +1 or above, and that's the age of a bone of a young 20-year-old woman or man. And then what happens as we get older, we start going negative. And osteopenia is that grey zone before we hit osteoporosis. And it's a moment where we can actually start looking at our bone health and go, well, actually, what can we do to actually improve it? And that's where diet, particularly involving vitamin D, and then exercise, so weight-bearing exercise. So unfortunately, astronauts up in space, their bones deteriorate with every month that they spend up in space, whereas you come down to Earth, you're on weight-bearing exercise, and therefore there is evidence for impact training to remodel bone. So it's really important. If you speak to Eva about bone health, she will start talking about exercising her patients. Prostate cancer patients are actually encouraged to literally do jumping exercises to remodel their bones. And so you can actually change that sort of that acceleration of aging in your bone health through exercise. So it is vitally important, and particularly patients who are going through immunotherapy, if they encounter having to have steroids, their bone health can also be detrimented. So it's not just the hormone positive patients who might be on aromatase inhibitors. There is another group of patients who are at risk, and it's really important we actually proactively prevent that deterioration in bone loss, because if you're cured but you end up with osteoporosis and nobody has actually addressed your bone health through talking to you about vitamin D or talking to you about exercise, it's like, well, that's great, but you haven't actually survived and lived and thrived. So we need to really encourage that within a clinic, and then actually point them to the right people. So pointing them to Marina about an excellent diet to help their bone health, pointing them to Eva about the kind of exercises that are better for them. Sometimes people's wrists are actually less strong. And so sometimes I find a bone density where, you get a bit of information about your back and your hip, which is at risk of fracture. But if you don't get something about your hand and then you fall over because you've got a neuropathy from your chemotherapy, that's at risk. So it's actually really important we think about those three areas and really try to focus and improve that bone strength through exercise. There are other medicines we can give, but if you're stuck on a medicine that's going to increase the risk of bone loss, what can you do to reverse it? And that is through diet and exercise.
Okay, well, I'm glad you've raised this question, because there's one here from Jane about drugs. Jane has asked if there are some drugs that are better than others when it comes to the impact on bone density.
So there are some drugs which are actually good for people's bone health. So there is a particular drug called tamoxifen, which is actually related to an osteoporosis drug called raloxifene. However, not every dancing partner for a breast cancer patient would be with tamoxifen. It would be preferred that a patient may need to have an aromatase inhibitor. That brings down estrogen. It brings down postmenopausal estrogen. And unfortunately, sometimes we are actually pushing young women into menopause plus adding these drugs. And so, sometimes the dancing partner is good for your bones, but unfortunately, sometimes it's not good for your bones, but that is the preferred drug for the breast cancer.
Well, I'm loving your funky analogy of the dance partner very much, Di. I'm going to a question that's sort of allied from Joanne, whose question is around, this phase of life that we're talking about for heaps of women is they have a lot going on. Sometimes menopause is involved. Sometimes it's early onset menopause thanks to the treatment that they're getting. Joanne wants to know how you can maintain a healthy weight during and after breast cancer treatment once you factor in menopause.
Okay, so I think the first thing is to recognize it before that weight starts creeping on. So actually starting to talk to people and saying, look, the risk is that, this drug, although it's important to prevent your breast cancer coming back or to keep your breast cancer asleep, unfortunately can increase your chance of actually putting weight on. And therefore, sometimes referring to an endocrinologist who's with an interest in sort of what's called the metabolic syndrome. So there is unfortunately, the risk of these drugs actually pushing people into a state of insulin resistance and chronic inflammation, which is not so good for them. And that's when they put on their weight as well. And so if you recognize that, and you can refer to an endocrinologist that will proactively talk to them about diet and exercise, but also about potentially some medicines that can actually help them. It's just really important to acknowledge before the weight's been put on. Now, if they have put on weight, it's about celebrating not putting on more weight. So, sometimes, you put on a bit of weight, but it's trying to not put further weight on. So where possible, intervene before it happens. We've de-escalated giving steroids to a lot of patients who go through taxane chemotherapy, which has been a good thing because that put a lot of weight on people. But unfortunately, some of the ovarian suppression can actually, unfortunately, push people to put weight on. So it's recognizing it early, shut the cupboard door, go and speak to an exercise physiologist and a dietitian, and where possible, try and address it with some support. It shouldn't be punitive. You shouldn't be beaten up. If you want to have a celebratory feed. It's trying to have a moderated diet, but not trying to sort of, admonish yourself if you haven't, achieved, and it's trying to keep a healthy weight.
How do you talk to patients about this stuff, Di? Because, I mean, we're not stupid. We know that, like, women often already have a lot of baggage in their brains around weight and body image. And then we know that during breast cancer treatment, you can get a whole lot of other, guilts and anxieties that come in around, well, if I'd done more of this, or if I'd eaten less of that, or if I hadn't had, that champagne at Christmas or whatever, people are prey to a lot of guilt and anxiety. So how do you frame your discussion around this stuff with patients?
So on an individual basis, we know that carrying extra weight can increase risk of breast cancer. It can also increase your risk of relapse. But on an individual, you can't say that specifically their experience of what they did has caused a cancer to relapse. So I think being aware that, there are many factors. Sometimes it's just the biology of a cancer if it's going to do that. However, if you can do anything to improve your chance of a cancer not coming back, or living well and healthier, to be on a drug, to live well with your metastatic cancer, to then be able to then access future drugs, is really important. So it's not about, the individual's fault. It's about trying to support them and, trying to assist them with everybody that's working with us.
Well, I would also recommend listening to one of these panels that we do, because this always comes up, and I always go off and eat some cruciferous vegetables afterwards, because it's a very, very common message. Okay, switching to you now, Marina, because I've got some really specific questions that have come in from our... I see you've taken yourself off mute. Well done, champion. I'm going to start with one from Teresa, who has asked, what role does processed sugar have in increasing breast cancer risk and recurrence?
So sugar's had a lot of interest, and Melissa mentioned this at the start, one of the things that she was interested in when she was diagnosed. Sugar's had a lot of interest in the cancer space because there's been this myth that sugar feeds the tumor. And so any sugar you eat is going to be used purely by the cancer cells to grow and divide. Now, sugar's, however you eat, is broken down into glucose in your body, and that is what cancer cells will use as their preferred fuel source, the same as every other cell in our body. If you deprive the body of sugar, the body will just break down your muscle mass or your fat and convert that into the fuel source for cancer cells and the rest of your cells to use. So purely excluding sugar out of your diet is not going to have the benefit of depriving cancer cells. What we do know, though, that there is a lot of processed sugar and added sugar in our diets, and not just the natural sugars that are in our fruit or the carbohydrates that are in our whole grain cereals and stuff that we're eating. So there are processed sugars and foods that people are eating. And so there's been a lot more research now happening to try and understand, can we try and tease out a bit more about different types of sugars in our diet? And so some new research that's come out from the US is looking at sugar-sweetened beverages. And that's one thing that we know, empty calories, provide no nutritional benefit other than they might taste good when you're drinking them either on their own or mixed with something else. And so there's been lots of research now to really try and understand sugar-sweetened beverages associated with breast cancer outcomes. And what that actually showed us is even one drink, so one can a week compared to no sugar-sweetened beverages, is associated with increased risk of recurrence. So, a simple message that you can take away from this is, if you are drinking soft drinks or other sweetened beverages, trying to remove those. Even what this research found is, even if you replace one drink with tea or coffee or water, will reduce that risk. So trying to think about some easy changes that you can make within your diet, that isn't just around purely the breast cancer, that's going to be beneficial for your overall health as well if you're reducing intake of soft drinks.
Great, thank you on behalf of Teresa and everybody else who's mentally asking that question. There's one too from Joe who says, and this is like a big one that you hear about all the time, is there any proven benefit to fasting, either intermittent or short-term fasting, to help improve breast cancer outcomes?
So fasting has had a lot of interest generally in terms of weight management on a whole. Interest around fasting within cancer has been evidence in mice models, so in other preclinical models, that fasting can improve the effectiveness of chemotherapy. So there's been a lot of interest in, can we actually do fasting in the period leading up to chemotherapy, day of chemotherapy, and does that then make the chemotherapy more effective and therefore reduce your risk of recurrence? That's been shown in mice models. The evidence within humans is still lagging. What we do know of what's being done in humans is that people who are able to stick to that fasting period tend to have lower toxicities from their chemotherapy. So they might have less nausea and vomiting, less fatigue, they tolerate their chemotherapy better, less evidence of DNA damage to other cells. So there's evidence that it is potentially beneficial. We don't have good evidence yet, though, to show, is that going to be reducing risk of recurrence, and therefore this is now being recommended as part of routine clinical practice. One trial that was done that got a lot of interest was where they did it in women who had neoadjuvant chemotherapy. So this is chemotherapy before they've had their surgery. And the benefit of that means then that you can see if the chemotherapy is working better because you get greater reduction in the tumour in the breast. Problem with that study, only 1 in 5 women were actually able to adhere to that fasting period. So it was 3 days of fasting leading up to chemotherapy and the day of fasting of chemotherapy, which makes it really, really difficult for people to adhere to. So those who were able to, they saw benefit, but the majority of people can't adhere to that. And these researchers look to try and advance that by going, okay, let's just try and reduce the amount of fasting. That trial, as far as I'm aware, has been stopped early, but there's no details as to why that's been stopped. So I guess at this point, and I don't know if Di's got thoughts on this, but at this point, there's evidence to show that it's potentially beneficial. It is something that should be supervised, should be clearly discussed with your doctor if it's something that you're wanting to do. It's not something that's routinely done in practice in Australia. What I would recommend, and where there is no evidence, is long periods of fasting. So we wouldn't be recommending that people are doing extensive periods of fasting as a way for improving their outcomes.
Okay, thanks, Marina. Di, do you have thoughts?
Yeah, no, Marina, that it's actually really interesting because I haven't actually heard that for a little while, but that in the pediatric population, because a lot of little kiddies when they used to have chemotherapy, a lot of them used to sort of fast so that they weren't sick. And a lot of pediatricians actually talk about fasting to improve response and protect against for the normal cells. So it's really interesting that you're mentioning this. 3 days is a long time. You do wonder whether 24 hours would be better. And probably the reason why the research hasn't taken off is because we need sponsored trials that are not pharma sponsored, and pharma's not going to be sponsoring these kind of trials. And that's where breast cancer trials groups and other groups to sponsor these kind of interesting studies to see what can we do to improve both response and also reduce toxicity are important. Very interested to hear that it's still bubbling along. I don't think we've heard the full story on that yet.
That's such a great point, Diane. Also just underlines the importance of the work that breast cancer trials does, just to look at these issues without a pre-existing commercial imperative. I'm going to go back to you, Marina, with Shazia's question. She's asked if plant-based protein or animal protein is best. I know that Dr. Google and your friends will tell you a lot of stuff about this, but what do you say?
So overall, we know that higher total protein intake is beneficial. And the evidence that looks at separating out animal protein versus plant-based protein tends to show that they're both probably beneficial. So there's probably not any real difference. And there's no clear evidence that being vegetarian or restricting all forms of animal protein is beneficial in terms of outcomes from breast cancer. If we think about what we've talked about a bit is around maintaining muscle mass. And so if you look at, what's beneficial in terms of animal protein versus plant-based protein for maintaining muscle mass, they're both, again, beneficial. Animal protein, depending on the outcome that you're looking at, slightly better. But overall, I would say the main thing is thinking about, if you are having animal protein, still being mindful around what you're having. So again, taking that more holistic look at health. We know that processed meats should be avoided. We know that red meat should be limited to probably 3 serves over a week. These are things that we know are associated with other cancers like bowel cancer and colorectal cancer. So looking from that holistic perspective, if you are eating meats, just thinking about that animal protein, what types of meats you're having. So poultry, fish, eggs, dairy are all good sources of animal protein as well, and just restricting that. No processed meat and limiting the red meat.
Okay, awesome. Just quickly, another perennial one. Rosie has chimed in to ask if it's better to have an organic or non-organic diet to improve breast cancer outcomes. Is there a difference?
No evidence at all on whether they are, whether organic foods, fruits, vegetables, meat are better than inorganic. In Australia, we've got pretty good regulations in terms of pesticides and hormone use. So our inorganic foods, excuse the siren going past, the evidence is that there's no difference between organic or inorganic. The really important thing, if you can afford organic, have organic foods. It's not going to do you any harm. The problem that we know at the moment is cost of living is increasing, and cost of groceries as they are skyrocketing. And so if you're then going, I need to be having organic fruits and vegetables and I can only be eating organic meat, that's a risk and a cost that you don't need to take that isn't necessarily going to be detrimental for you if you're not buying organic products. So I think it's more important that you're eating your fruits and vegetables than spending money on organic products and not being able to eat as much.
Thank you. That's a really thoughtful answer, Marina. I want to just come back to you, Melissa, because I know that you're a foodie and I think you're not allowed to not be in New Zealand, but I know you also went through a mad juicing bender in the early days of your treatment. What did you find worked for you and your quality of life in relation to diet?
I think in treatment, I did become obsessed with juicing, and I think that was the hunt for the magic pill that was going to make the difference. But I think where I'm at many years later is it's all about balance, and I have found weight management hard, but I've found that hard much later in my treatment. So for me, the weight management became much more difficult when I switched from tamoxifen to an aromatase inhibitor, and it felt like it was overnight for me, and it caught me by surprise. So I did pretty well through treatment and through the first kind of 7-8 years after treatment. So for me, what works well now is I really prioritize protein. That helps with appetite management. And I live in a very small town with very little processed food. So, we eat real food and good food and enjoy it. So it's about balance, and I don't have hard and fast rules. And I just realized that, I look at my diet, my exercise, my stress management, my sleep, and I kind of bundle that together in terms of my overall well-being.
Just quickly, I know you mentioned earlier that this sort of sense that diet and exercise were areas that, were within your control to a certain extent. How did you maintain good boundaries in terms of mental health with those feelings of sort of guilt and anxiety that, you weren't eating the right thing or you weren't doing enough exercise? I know there's so much strong feeling about that, particularly among patients who already feel a bit out of control and very, very worried, obviously.
Look, I think it's a hard challenge for anyone going through this. And I really feel for those who are here tonight who are right in the midst of active treatment, because I think that's where it's very complex, because you're trying to grapple with why you have this disease, what your life should look like now, what you want it to look like moving forward. And I guess the one thing I would say is to stay connected with other people who are going through the same thing. I hate the word journey, but who are enduring the same thing. And I think as we live our lives, we see people who don't have great outcomes, and they're very often the people who are doing everything right too. So it's not a tick chart. It's not as simple as that. You need to live a life that brings you happiness and satisfaction, but gives you a good shot of coming through it unscathed. But it's a very fine line we walk, and it's never easy.
Right. And I can tell even just from listening to you and seeing the way that you interact with us in the world that that being connected to people and having a sense of humor and being able to conserve parts of your life where you get pleasure is actually, you know, has an effect on your general mental health and sense of well-being, right? It's kind of hard to measure all that stuff, but I can tell just from watching you talk that you've obviously sorted that out to a really significant degree. And thank you so much for the beautiful way that you've spoken about, I'm just going to say it, your journey. Thank you for talking about your journey, Melissa. Sorry, I know that annoys you. I'm going to go to Eva now because there's a question from Deb, which is, how long does it take to show improvement in bone density when you start weight-bearing exercises? How long is it going to take? Am I there yet?
Yeah, good question. And Di alluded to this a little bit earlier, that, you know, we have had studies looking at the effects of exercise on bone health. We probably need a few more studies to really determine with certainty, you know, how exercise can improve bone health in people diagnosed with breast cancer. Currently, what the studies show that we actually probably need closer to at least 6 to 12 months to see a difference. And what we need to engage is sort of moderate to higher intensity, like resistance and potentially impact training, which Di also referred to, which could be, you know, you're jumping, you're skipping. And what I think is crucial, and we need that because we actually need to load the bone. Yeah, so swimming, for example, won't help. So we need exercises where we actually have, you know, some stress on the bone to have, you know, have the changes or stimulate the changes in bone health. What I do want to say is that this can be a quite, you know, intense program that you're doing. So I would always recommend to, you know, seek some support initially if you're going to start that program. And it's also important to consider that it might not be appropriate for all individuals. So if we have someone who has bone metastases, for example, that are at risk of fracture, you know, we actually don't really want to load those too hard because they can fracture. And if someone has already developed osteoporosis and has, fragile bones, then we need to consider that as well. So it can be beneficial. It can take a while, but and it's a good idea to initiate it. But I think I would suggest just seeking out some support to really guide that prescription.
Okay, there's lots of factors here. What's a good exercise for this? What's good for that? What you should avoid. It's like a bit of a confluence of factors. But we're getting a lot of questions about some broad principles. And Libby, for instance, has asked, what's the best exercise to mitigate breast cancer recurrence?
Yeah, that's another big one.
Right. So if you could sort that out for us, that'd be awesome. Thanks, Evie. You've got about 30 seconds. So
yeah, first of all, I think it's important to highlight, and I think Marina said this earlier, that there's many factors that contribute to recurrence. And so what, we are currently observing is that we may improve lower the risk of recurrence through exercise. Most of the evidence we have come from observational trials. So people are followed for a longer period of time, and then they're asked about their activity levels, often also retrospectively. And so we still need to figure out what the best medicine, I should say, or the best exercise prescription is. We, on that sort of bigger observational level, we see that those that sort of meet the exercise guidelines, which is around 2.5 hours of moderate intensity exercise per week, that they have reduced risk of recurrence, and that's up to 50, just over 50% in one of the studies. So that's quite significant. If you break that down, because that can sound quite a lot, but if you break it down, it's like approximately 20 minutes of brisk walking a day, or anything that equates to that. So that sounds a bit more manageable, but whether, we tend to hope or think it's probably a combination of aerobic and resistance, but we still have to, ideally do those controlled trials where we have an intervention group and a control group to see exactly what exercise would be the best.
Okay, so I'm sorry to keep putting you on the spot, but these questions keep coming in. And Jennifer says, I think this is a common experience. She was very active and played sport before her breast cancer diagnosis. Now a bit doubtful about what the best type of exercise is for her to pursue during breast cancer treatment. Do you have anything incredibly simple that you can say about that?
Yeah, so I would say that it really depends on your individual goals and your side effects. So what we try to do is when someone comes in with a diagnosis is to see, okay, what treatments are they receiving? What side effects might they develop or are they experiencing currently? And then coming up with a plan how we can best manage or target those. From everything we know, it's probably a combination of aerobic and resistance training that'll be most beneficial. And so aerobic training includes, exercises that improve your function of your heart and your blood vessels and your respiratory system. So that's exercises like walking, cycling, swimming. And then we have our, resistance or strength training, which Melissa also did, which is like, your weight training. And that's really to improve your muscle strength and muscle mass. And we know from a number of trials now is that, if you have more muscle mass, you potentially also have less toxicities and might have, less chance of recurrence as well. And so these are a combination of exercise that we would recommend. In saying all this, there's many sports that involve aerobic and resistance exercise components. And so if someone really enjoys playing tennis and they've always played tennis, there's no reason they should stop playing tennis unless there's, a specific side effect or a contraindication to playing tennis. So I think it's really important to find something that you enjoy. And we did a lot of, there's been a lot of research in aerobic and resistance training, but we're actually seeing more evidence in some of the body-mind exercises as well, particularly with, fatigue and emotional distress, where, your yoga and your Tai Chi can be really beneficial as well.
Okay. You guys have all been so interesting that I'm now running about 3 minutes behind. So Jennifer has a question, which I'm going to ask you to squeeze in quickly if you can, Eva. Just looking at asking whether there's been any research on timing of exercise around chemo appointments, before, after, what's the best approach?
During.
It
is. Yeah, there are little pedal machines that people in the chemo suite they're pedaling. Okay,
and does that have a therapeutic? Does it have an actual clinical, by keeping your blood circulating? Does that play a role?
Well, Eva, you better speak to that one. But that's a real thing. The problem is, from an occupational health and safety point of view, that sometimes in the chemo suite they're a bit worried about people tripping over them. So that's the only problem. So Eva, you talk.
Yeah. I think Di's absolutely right. There's studies happening in that field. We also, though, had a study in Scandinavia that had to be stopped due to very severe adverse events while exercising during chemo administration. So I would be just a bit cautious until we have those studies that have been done. Currently, and I would say it depends a little bit on the chemotherapy you receive. So there's no issue at all around safety to exercise before your chemotherapy infusion, and we have a lot of patients doing that. However, we tend to recommend to avoid more moderate to high intensity exercise in the 24 hours after you receive a cardiotoxic chemotherapy. So there's some chemotherapies that affect the heart more than others. And if that's the case, that doesn't mean you can't, go for a walk or do yoga. But in those 24 hours after, we would avoid sort of more intense exercise. But otherwise, you're likely to figure out within your treatment cycles when you feel, again, most energized and best place to exercise. And other than that, can be really time during the treatment cycle.
Great. Thank you so much. That's super helpful. I'm going to go back to you, the audience, now, because we've got our second set of poll questions. Again, go to that 3 dots at the bottom of your screen The new poll questions will be there. It's about exercise and whether exercise has had an impact on your breast cancer experience. Notice I didn't say journey there, Melissa, out of deference to you, and quality of life during treatment. And once again, I'll be back in a few minutes to let you know the results of that poll once you've all obediently complied with it. Marina, we're coming late to this question because I'm running a bit late, but booze. Let's go there. Louise has asked if you can explain if there's any link between alcohol and breast cancer.
Really good question, Louise. Booze, alcohol, a big part of Australian society, and so an important question to be asking. Alcohol's associated with increased risk of about 8 different cancers, and breast cancer is one of those. And most people think about liver cancer, the cancer associated with your gastrointestinal tract, but breast cancer is associated with alcohol associated with increased risk of breast cancer. And particularly for postmenopausal breast cancer, that link's quite strong. We think it's that different pathways, but when alcohol is metabolized within the liver, it's broken down to a chemical, a toxin, and that contributes to DNA damage. And so we think that then leads that cascade of pathways. So yes, associated with increased risk of getting breast cancer.
Okay, what about recurrence? Because Christine wants to know if it works differently with recurrence risk.
Yep. So then, lots of interest around going, then if we know it increases breast cancer risk, should women be stopping drinking alcohol, or can we recommend that you can continue drinking alcohol? The evidence actually shows that there's no association with recurrence risk. So once you've had breast cancer, there's the studies that have been done show no link between alcohol intake and risk of recurrence or survival from breast cancer. What we do possibly know, though, from a small number of studies, is that it probably increases your risk of a second primary breast cancer. So you might not get recurrent breast cancer, but you may get another breast cancer, or you may get another new primary in a different location. So there is a risk of other primary, but no evidence to show that it's associated with recurrence.
Okay, that's so interesting. Okay, and Elizabeth has asked what I think is a very seasonally appropriate question, and you hear it all the time. Is it necessary, she says, to abstain from alcohol completely, or is it okay to have a social glass or 2 of wine?
If you ask cancer organisations, they'll say from a cancer perspective, any amount of alcohol will increase your risk of cancer. If you ask Heart Foundation or from a cardiovascular perspective, they'll say small amounts of alcohol can be beneficial. So I think you need to put things into perspective and consider your own individual risk. If you are choosing to drink alcohol, then just staying within the recommendation. So glass or 2 of wine, alcohol should be fine over Christmas.
Okay, thank you. Everybody needs permission. Okay, Di, I'm going to swivel to you now. Got a question from Francesca with a reasonably detailed proposition. She says she prefers weight training, walking, and Pilates, but should she also include cardio in an exercise plan?
So walking, depending on your definition of walking, whether it's Kath and Kim's speed walking, because that is cardiovascular. So I think you're doing pretty well at this stage to be able to do all 3.
I was thinking too, thank goodness you said that, because I thought, Francesca, you sound terrifying.
Well, I also ran it past one of our McGrath nurses. We both looked at each other going, she's doing a lot. So cheers, Erin. Look, at the end of the day, I think stick with what you're actually enjoying doing. Pilates, that anybody that's actually done Pilates would actually acknowledge that there is quite a large element of putting your pulse rate up and actually getting breathless, and that is cardiovascular exercise. So
the only form of exercise that I genuinely enjoy. I love Pilates. Everything.
Yeah. So trying to suddenly change tack and not do something that you've made a habit and then want to enjoy it. You've got to make sure that if you switch, that it's actually enjoyable and you're actually going to stick with it, because at the end of the day, it's behavior change. So we want people to continue exercising in a way that is compatible, that they will continue to do it. This isn't just a 6-month, commitment. This is a long-term commitment to actually improving your long-term health. So was it Katrina? I would actually say congratulations. Maybe put on the Kath and Kim outfit and speed up a little bit if you want to. But you are doing an exceptional job if you can actually fit those 3 different things in. And the other thing to say is that because of the taxanes that we do prescribe for our patients, I would actually encourage people to think about their balance. And any exercise that can actually improve your balance and maintain core is actually really important, because we know that long term, in sort of 5 years, there are published data that says that people at slightly increased risk of falls. Yeah. So I would actually encourage people to think not just about cardiovascular, not just about strength training, but also about balance training. And that's where the Tai Chi can potentially come in addition.
Yeah, okay. And I think there's an invaluable message there about what you count as exercise and what you don't, right? Because Francesca's like, well, I'm walking, but do I need to do cardio? I think that walking is sort of a bit overlooked sometimes, or even just those behaviors that we talked about earlier about, taking the stairs and walking, parking a little bit further away from wherever it is you're going. You don't necessarily need to be in the full sweat gear and, pumping iron or, running on a treadmill for 20 minutes to get that kind of exercise that challenges you a little bit on a day-to-day basis. I've got a very specific question from Lee, which I think will be relevant to some people. What exercise would you recommend for somebody with cellulitis following treatment, where walking can be a bit of a challenge? And again, if you wouldn't mind explaining to me exactly what cellulitis is, that would be helpful.
So cellulitis is basically a soft tissue infection, and for some people it can be absolutely debilitating. It can be very difficult to exercise. So particularly people with lower limb edema for whatever reason. And so that is incredibly difficult, because obviously, if you imagine a limb that's swollen, it's red, it's angry, and then we're saying, and you should go for a walk and do huffy puffy exercise, for 30 minutes a day. So generally that's a very difficult thing, and therefore talking to an exercise physiologist or a physiotherapist about perhaps doing exercise that's not going to put pressure or pain into that limb. Obviously, sometimes people can get cellulitis in the actual breast tissue or to do with lymphedema. And again, that's incredibly difficult. So trying to improve, the lymphedema management to reduce the risk of cellulitis. And then also thinking about, if people have diabetes or pre-diabetes, making sure their glucose control is good. So therefore, any form of exercise that will actually improve their glucose control will also be important to it. Because if you've got uncontrolled cellulitis, you've got to wonder, how are your sugars as well. But it's incredibly difficult for those people who do have that problem.
Okay, I'm going to give you the results of the second poll in just 1 second, but it feels like a good moment to pivot to Eva and ask a question from Stephanie, which is a pretty simple one. When shouldn't you exercise?
Yeah, good question. And I mean, we have our, general contraindications, as you say, to exercise if you have a acute or uncontrolled heart disease, that we have to keep in mind. If we think more of the cancer specific situations where we would advise not to exercise or to stop exercise is, for example, when you have an acute infection or a blood clot or fever. So in that case, just not worth and not taking the risk. So just don't exercise. Also, when you have really severe nausea, vomiting, pain, or dizziness, we also recommend to not exercise. There's a few other situations where we would probably adapt the intensity or avoid certain body regions. So that includes, for example, if you had a recent surgery and the wound hasn't healed, then we have to be mindful of that and, avoid exercising or aggravating the wound site. I mentioned before the cardiotoxic chemo. So in that 24 hours post cardiotoxic chemo, we would just, avoid higher intensities. And then maybe just commenting again also on pain. So it's really important to, stop exercising if you experience an increase in pain or severe pain. That doesn't mean some patients are worried to tell us because, they're worried they can't continue exercising. That's not the case. We just need to clear that. And we can often avoid the areas where the pain is. But that's really important to be mindful of.
Okay.
And then,
another good reason to have an expert pair of eyes like yours, somebody who knows exactly how all these levers move.
exactly. Yeah. Find a exercise physiologist in your area if you can, to just get some guidance.
Okay, so I'm going to go to the responses to this poll too. In response to the second poll, 77% of respondents said yes, they changed or modified their exercise routine after they were diagnosed with breast cancer. And 83% of people said that yes, their exercise did improve their quality of life during and after breast cancer treatment, which is pretty astounding, right? And I can see Dr. Di nodding her head and thinking, why aren't there better Medicare?
Yeah, if only we could fund it, Annabelle. Funny, yeah.
Okay, so you all know where your local MPs are, and this is a pretty significant producer of good effects, you'd think, for a highly contested public dollar. But anyway, I can't make a comment on that, but public pressure is always a good thing. Listen, I'm just looking at what we're getting a lot of questions in on. I think I might just ask, because we're getting a huge amount of questions about soy. And I know that around diet, this is like a big thing at the moment that people are talking about. So, Marina, I might ask you if there are any foods that should be avoided, and does this change for different types of breast cancer? And can you talk about soy?
So there's no single food will cause breast cancer, no single food will cure or prevent recurrences. So there's no single food. Soy is one food that's had a lot of interest for a number of years. So soy is a phytoestrogen. So particularly women who have had estrogen receptor positive breast cancers, there was a lot of concern around should they be limiting the intake of soy foods because that might be progressing their tumor, but then also interest that Japanese populations have low breast cancer, so maybe we should be eating more soy. So there's been a lot of confusion around what you should be doing for soy. So the World Cancer Research Fund recently updated the evidence around that. That evidence showed that soy does not increase risk of recurrence or any poor outcomes. Their recommendation, though, is still quite cautious. So what they say is if you were eating soy foods prior to being diagnosed, there's no reason that you should stop eating. So continue eating. If you weren't eating soy foods previously, there's no evidence to say that you should go and start eating a whole heap of soy. So it's really just continue what you were doing beforehand. It's not to say that you can't have some tofu once, but it's saying don't just go and start eating a whole heap of soy after your breast cancer if you weren't doing that beforehand.
Okay, thank you. That's a really helpful answer. I'm going to ask you to crack through the next couple. Annalisa has asked a really good question, which is, like, what about when your taste buds turn metallic during chemo? Are there good foods you can eat during that, we hope, temporary period of disruption where you just feel, well?
So for most people, that taste alteration will pass after treatment finishes. The main thing is finding the foods that taste awful and are metallic and then finding alternatives to that. So often it's meat that can have that really metallic taste. And so thinking about some alternate sources for that, is it chicken breast, is it boiled egg, is it cheese, dairy foods, or other things that you can be eating instead of the meat? Sometimes it's a bit of trial and error. So is it adding extra flavors, so herbs or spices or other things that are going to help? It could be as simple as trying and using bamboo or plastic cutlery. We're not using plastic now, but using other cutlery, because sometimes then having the metal knife and fork just reinforces that taste.
A really smart piece of advice. Thank you very much, as is all your advice been. Thank you. And I'm hitting you up one more time, Marina, from Tasha, who says, do you have any recommendations about how to get your appetite back after treatment? Because obviously people go off food a little bit, don't they?
And again, this is something that will typically come back after treatment. If it's been a while since your treatment's finished and you're finding that it hasn't returned, I'd probably have a chat to your doctor or reach out to Cancer Helpline or someone else, because it could just also be an underlying level of fear and worry, and that anxiety could also be impacting on appetite. So if it's continuing for a long period post-treatment, I'd probably have a chat to someone and see if you can get some support with that in case there's something else that's contributing. But the most common tips are just trying to have small, more frequent meals over the day. eat what you feel like, when you feel like. If that means that you're having cereal for dinner or whatever it's having, you have those meals. Going for a walk or doing some exercise before your meal can help to stimulate your appetite. If strong cooking foods, smells and foods make it worse, get someone else to do all the cooking for you and avoid doing that. And again, just thinking about flavors. So again, is it herbs or salt or stuff that you can be adding to food to make to improve the taste and help with appetite?
Right. And I guess, I think Melissa's example is so inspirational because she's sort of changed the way she exercises to respond to her other needs in terms of her mental health. And I guess eating is kind of the same, right? Like, I mean, if you're in a really established pattern pre-diagnosis, be open to the idea of changing the pattern of your eating and your expectations of what eating is going to be and when you're going to do it. And even opening yourself up to new possibilities in terms of texture and flavor. Thank you so much, Marina, for your really beautifully thought out responses to these questions. We are so out of time, and I want to thank all of you for what's been like such a cool and informative panel. So thank you, Melissa, Di, Marina, and Eva. I'm going to take some things away. Huffy puffy exercise is a phrase I'm going to use relentlessly now. Thank you very much, Di. And Melissa, I think you've given us so much to think about in terms of the way you've opened yourself up to changes in your life over this process. And thank you, Marina, too, for normalizing cereal for dinner. And Eva, if we all had an Eva in our lives, I think we'd all be better off, right? Anyway, thank you so much for the time you've given us all this evening to help close a few of those gaps of knowledge and understanding in what can be a slightly overlooked field when people's lives are turned upside down and full of conflicting and confusing information and fears. So a reminder, this Q&A has been recorded and will be available on the Breast Cancer Trials website tomorrow. So the team will send a link through so you'll be able to watch it or share it with anybody you think it might interest. You know that Breast Cancer Trials is committed to improving outcomes for every person diagnosed with breast cancer through clinical trials research. And as you know, it will focus on different areas from big pharma, which is a really valuable thing. It runs on the participation of people like Melissa, who are volunteers. And it also runs on donations and support from people who have benefited from trial research. Which brings me to this thing. This is the Australian Women's Health Diary. I've had a little glance through it. It is full of really interesting bits of information, and it is also a handy organizer. So if you want to keep track of your dietary and health and exercise changes, I'll recommend it. And it is available at the post office and at Woolworths, or through the Breast Cancer Trials website at www.breastcancertrials.org.au. So it's a helpful resource, and it also helps to undertake the kind of research that has a huge beneficial effect for current and future people diagnosed with breast cancer. You will get free postage on that diary if you order it from the Breast Cancer Trials website and enter the code AWHD 2025-free. Thanks again for watching, everybody, and thank you to our wonderful panel for joining us this evening. Good night.
Australians are practical people. We like things that work, that do something. So what about a useful, everyday diary for women, full of essential health information that saves lives? Now that's something. The Australian Women's Health Diary funds breast cancer trials. Every dollar goes to trials research that saves and improves the lives of people with breast cancer. The Australian Women's Health Diary, the diary that saves lives.